Because you didn't say it.
Oh, there we go. I'd like to thank you guys all for coming out today. We're very grateful for your turnout, as well as for our presidency, as well as Dr. Fitzer for being here. We have a wonderful presentation today by Jason Stevenson, but first I'm going to introduce Dr. Carla Trentleman. She's probably the person who got me into doing a lot of my volunteer work. She's a sociology professor here at Weber State. She's been teaching since 2008 up here at Weber State, and in the fall of 2009, Dr. Trask, our former pre-med advisor, approached her to do a similar presentation to this on the Affordable Care Act, but it hadn't yet passed, so it was in the debate stage. And so I'm going to allow her to introduce Jason Stevenson, who she put us into contact with. So if it wasn't for her, we wouldn't be able to have this wonderful meeting. Dr. Trentleman.
Good afternoon. It's really a delight to be able to be here. What ended up happening from that introduction between Dr. Trask and myself was that at the time I was the advisor of the Social Club, and Dr. Trask was the advisor of the Pre-Med Club, and we decided that it would be far cooler, because this was the fall of 2009. If you think about the ACA, if you know your history, fall of 2009 was when things were getting really, really ugly with all the debates about whether it should pass or not, whether, all of that kind of jazz. And so Dr. Trask and I and the Pre-Med Club and the Social Club not only did a presentation, we actually put together a series of presentations on healthcare reform. We had 3 presentations in the spring, or in the fall, and then after it passed in the spring, we all decided, yeah, we got to do one more. So we did one more in the spring after it passed. As a part of doing that series, I had the delightful opportunity to become familiar with Utah Health Policy Project. And trust me, they rock. At the time, Judy Hillman, who was one of the co-founders of that organization, came and did one of the presentations, one of the chunks of the series in the fall, and then she also, along with a couple of other folks, came and did the spring presentation for us. I was very, very impressed with the material that they presented, but I was also really impressed with what else I was learning about UHPP. I have tremendous respect for them. They have been working on these issues since well before the ACA passed. In fact, they were working with our state legislature here in Utah on establishing a statewide market exchange before the ACA even passed. In fact, they were approaching the state legislature basically saying, we have no clue if this thing is going to pass or not, but we have some problems in Utah that we really need to be addressing, no matter if it passes or not. And they actually managed to get the state legislature to be willing to have that conversation, which is pretty outstanding. Their website is a great place to find really current information on issues about healthcare reform. In fact, I'm teaching medicine and healthcare and society right now, and most of the readings that my class is going to be using next week in class come from their website. So really excellent organization. And Jason Stevenson is the guy who gets to take credit for that part, for the website and all of that kind of jazz, because Jason Stevenson is the Education and Communications Director at the Utah Health Policy Project, where he edits the Health Matters newsletter and organizes the statewide Health Reform 101 presentations like this one today. Jason is a former economic development consultant and editor at Outside and Backpacker magazines. Jason and his wife Jackie, who is a family doctor, live in Salt Lake City. And with that, let's welcome Jason Stevenson to Weber State.
All right, can you all hear me pretty well? Great. Thank you very much for having me come out to Weber State. It's my first time on the campus. Can everyone hear me in the back? It's all good? Okay. We don't have a wireless slide changer, so Jason has volunteered to help us out. So I'm just going to wave over at him every once in a while. I guess we can go to the first one right now. We've got a lot of things to talk about. In fact, I pulled out some really special slides just for you that we don't normally use in our health reform presentations we do around the state. Primarily because this is a topic that is not only interesting in an academic sense to you, but perhaps also in a career sense as well. How is health reform going to affect what my job's going to be like, what my income's going to be like, where I'm going to be working in the next 10, 15 years. So I added some details there. You can see we will cover the basics. What is the ACA? What's happening here in Utah with regard to health reform? Inside Utah's insurance marketplaces, we're going to get inside the machine. We're going to look inside the website. We're going to look at that crazy website. We're going to look at the options that people have here in Utah when they're going and searching for insurance. How much it costs, what it looks like, what kind of providers are providing this insurance. And then we'll look at the health reform and health careers. How is health reform going to impact folks who work in any kind of health reform, not only doctors and nurses, but folks who work in education side of health and sort of mental health specialties and so forth. We'll take a look at navigators and enrollment. How are people signing up for this insurance? We have some new data on that just from this week. And then finally, if we have time, we'll get to the major public policy decision facing Utah right now, which is about Medicaid expansion, whether or not to expand Medicaid, which is a health insurance for low-income people, to a bigger swath of our population. And that's really what the legislature is going to be dealing with and the governor over the next couple of weeks. Go to the next one. As Carl mentioned about UHPP, we are a nonpartisan, nonprofit organization. We've been around almost 8 years here in Utah. We're homegrown. We're not a part of any national group. And we've been working on health reform going way back. I mean, for the past couple of years, we have been focusing on bringing Obamacare, the Affordable Care Act, to a soft landing here in Utah. That's been our major focus. But we've dealt with a lot of other issues along the way. We're on the web, healthpolicyproject.org, on Twitter, we're even hip like that, and on Facebook. We put a lot of information out there. We have a lot of policy research we do, a lot of coalition building and organizing, especially gearing up for the legislative session, which is occurring, of course, later, early next year in January. We do a lot of work up at the Capitol in Utah. So we can go to the next one. Before we get started, though, I wanted to kind of touch on the dashboard. This is what we call the important information you need to know about the Affordable Care Act. And this is probably for just talking with your friends, talking with your family. People probably look to you guys as experts in healthcare issues because this is what you study, this is what you're focused on. So here's some information that you can share. We all know that the Affordable Care Act is also called Obamacare, also called the ACA. I use all three terms. Feel free to use whichever term you like. People could start signing up on October 1st, just about a month and a half ago. And that open enrollment period goes from October 1st to March 31st, signing up for these new insurance options. We'll talk about how that happens in a little bit, but I wanted to give you the dates. The insurance starts on January 1st. That's the earliest it can start, New Year's Day of this coming year. But if you want that insurance to start on January 1st, you have to sign up by December 15th. If you sign up on December 20th for this insurance, it's not going to start until February 1st. The 15th of the month is the cutoff for having your insurance start the 1st of the next month. So if you sign up on January 10th, your insurance starts February 1st. If you sign up on January 18th, your insurance will start March 1st. So that 15th of the month is an important deadline to consider, especially if you're trying to time coverage to kind of kick in right when some other coverage ends, which is how most people are going to be doing it. So those are the dates, the things to keep in mind. Open enrollment next year is going to be a lot shorter. It's going to be from October 15th until December 7th. So very much tighter open enrollment period for everybody to kind of jump in and get this new insurance. Guess we can go to the next one. Now, these are the numbers that came out this week. You might have read some news articles about how many people were actually signing up for Obamacare on healthcare.gov. And the numbers are not very good. And a lot of that is because the website has been so abysmal for the past month and a half. Look at this one over here. The number of Utahns who have selected a plan is 357 in the first month of open enrollment. That's the number of people who have actually gone in, either put a plan in their shopping cart or actually paid for it and bought it. So 357. I think they thought that number would have a couple more zeros after it when they were trying to launch this thing, not just be that small. But if you actually look at the rest of the numbers, you see, there's 9,000 people who have completed an application and are eligible to buy the insurance here in Utah. And actually about almost 4,000 who are eligible for these new premium subsidies, which I'll talk about. So there's a lot of folks in the pipeline who just haven't actually gone ahead and bought that plan. So although 357 is a pretty disappointing number, there are thousands that are still in the shopping experience, and probably many more who are just waiting for those deadlines to get a little bit closer. I mean, the way I like to talk about it is how many people do you know have bought all their Christmas presents yet? Not too many. We tend to wait for the last minute when we do this kind of thing, and the same thing applies to insurance based on the experience of Massachusetts, which pioneered this a couple of years ago, and other states as well. So disappointing numbers for sure, but we're optimistic that they are going to get better as more people sort of actually choose and buy their policies. Thanks. And here's one reason why those numbers are pretty bad. These are some other abysmal numbers. This is a survey the Kaiser Family Foundation does about what people think of the Affordable Care Act, what they think of Obamacare. It has never been more popular than 51%, going back the last 3 years. Currently in October, it's 38% favorable. Now, we could say it's more favorable than Congress, but there's things you scrape off your shoe that are more favorable than Congress these days. So it's really had a public relations disaster. Even the people who are supposed to benefit from it don't like the Affordable Care Act. And actually it's funny because they usually don't like Obamacare and they like the Affordable Care Act. They don't realize it's actually the same thing. So there's a lot of misinformation, there's a lot of education deficit that we're facing. And one of the things is that for most of this time, the Affordable Care Act was a theory. It had some impact, it was happening a little bit in people's lives, but it was something that was going to be happening further down the road. And the one thing we know about Americans is that we really don't like things when they're a theory. It's only once they become a part of our fabric, of our culture, or how we do things, that we start to really understand them. We're kind of late adopters in that regard. So these numbers, as bad as they are actually pretty predictable if you looked at other social programs from Medicare Part D, launched in 2006, to even going back to Social Security and Medicare. People don't like things they can't actually touch and feel. And so really Obamacare is something that people are only just starting to touch and feel at this moment. So again, horrible numbers. If I was a public relations agent and Obamacare was my client, I'd be really, really upset right now. But we think that those numbers are probably going to be going up as more people start to realize what it actually is. Start to get the facts about it as opposed to a lot of the misinformation that's been out there. We jump to the next one. And here's one reason why sometimes what used to be doesn't always have to be the case. Look at this ad. More doctors smoke Camels than any other cigarette. This used to be in magazines across the country. Can you imagine an ad like this appearing today in our society? Things change. Healthcare policies change. People's expectations about what is good and what is bad have definitely shifted over time. So if you think that everything stays static and stays the same, all you have to do is think of this ad. And I put this up here because I want to look at what life was like before the Affordable Care Act. Actually somewhat like the current system we're in right now. We can jump to the next one. The United States has a great healthcare system. We cover, we do some really good healthcare here, but we also pay quite a lot of money for it. We're number one in the country, or number one in the world, and especially among other developed nations in what we pay for it. So we have good healthcare, but we pay for it, quite more than many of the other countries out there, including countries that don't necessarily have nationalized healthcare. Countries like Switzerland or Germany have kind of dual systems there. So we often hear the U.S. does have great healthcare, and it does. But we have to realize that it comes with a price tag that is also pretty high. Jump to the next one. The problem is that even though we pay so much for our healthcare, our health outcomes aren't so hot. We actually don't rank as well as a lot of the other industrialized countries in some some common things like heart attack, life expectancy, infant mortality. Part of it is that we have a pretty diverse and big population compared to other countries. And some of it is that our healthcare is really good in some parts of our country and really bad in other parts. Or people who don't have access to our great healthcare end up having these kind of bad health outcomes, more so than people who do have access to it. So we've got a bit of a spotty system in terms of, we pay a lot for it, but maybe we're not getting the best result out of it. It's kind of like you go to a really fancy restaurant and you order the steak and it costs $80 and it comes out and it's completely charred. Why do you just go and spend $80 on a steak that is inedible? Well, in some cases, that's kind of like what our healthcare system is. We pay the most, but we're not getting, the prime rib. We're getting something a little bit more like Spam in some cases. So, something to keep in mind. One more slide. And then one reason why we do have so much expense in our healthcare system is we tend to pay more for the same things. If you look at what an appendectomy costs in the United States, based on data from 2010, it's almost $8,000. Where if you go to Germany, it would be $3,000. I don't think their appendixes are any harder to take out than our appendixes or anything like that. They, tend to, have the same kind of internal body organs. But for some reason, it costs a lot more across the board for doing the same things in the United States that it does in other countries. Elizabeth Rosenthal, who is a New York Times reporter, has spent the last year focusing on why our costs in the United States are so much higher than other countries. She's got a great series called Paying Till It Hurts. Elizabeth Rosenthal in the New York Times, really looking at, why does our asthma medicine cost, for $20 we can get 5 pills in the United States, and in England you can get 300 pills for the same amount of money. Why is that different? Why are those sort of embedded costs happening in our country? And the funny thing is that the Affordable Care Act actually doesn't deal with any of this, which I'm about to get to. These cost issues, the things that I'm throwing up here, really isn't in the Affordable Care Act at all. I'm putting this up there as sort of a challenge to you guys to let you know, hey, this is the reality of our healthcare system. And the Affordable Care Act is only tackling some of the problems and some of the challenges that we have in this country. It's going to be on you guys to tackle this stuff here, because this is going to be for the next generation of healthcare workers and healthcare reformers to deal with. Jump to the next. And here's another reason why. You might say, well, boy, the United States is a pretty rich country. Maybe that's why all of our healthcare system's more. We have more money than Greece or Sweden or France or any of those countries. But if you actually plot that, and I only pull out this regression analysis for certain audiences, and you guys are lucky enough to get it. If you plot GDP per capita versus healthcare spending per capita, accounting for the wealth of the country, we're off the chart. We're way up there. Luxembourg is off the chart as well, but I think there's 6 people who live in Luxembourg, from what I can tell. So maybe that's right. They're a little bit of an outlier. But we are spending more even with the extra wealth that we have in our country. We're not on the line that the other countries are. Now, do we want to be on that line? I don't know. That's a big question. Do we want to spend less for health care? Well, will we get worse healthcare results? Will we not have as good of care? Those are questions that are going to have to be figured out next in terms of health reform. And the Affordable Care Act, as I mentioned, doesn't really cover that. It sort of just takes a small bite of that apple. But I hope I've convinced you in these 5 or 6 slides that we do have some significant issues to deal with in the United States. And it's really going to be something for the next, not just 3 years of what people are talking about with the Affordable Care Act, but really the next 10 to 15 years. And it's going to carry over into the careers that you're developing right now. But let's jump a little bit more micro. This is the webpage for the Massachusetts Health Connector. You might have heard that Governor Romney, back in 2006, signed into law what was known then, or known later, I guess you could say, as Romney Care. Massachusetts pioneered many of the elements that are now happening across all 50 states under Obamacare. And when Massachusetts did this in 2006, their uninsured rate was about 12%, which is pretty low compared to states like Texas, where it's 25%. Massachusetts already had a pretty good system going. But by 2013, they brought it down to 3 to 4%. I've even heard 2%. So in 7 years of health reform, they were able to bring a lot more people into coverage, even when they were already doing a pretty good job compared to other states. And they did it using the same model that the Affordable Care Act is now pushing and trying to create across the country. And now, it wasn't easy for Massachusetts. They had a lot of issues with cost. They had a lot of issues with containing the cost of healthcare. They're one of the most expensive states in the country for healthcare. They had a lot of trouble reaching out to partners like hospitals and insurance providers and getting them all to participate in this. And their website was really bad when they started out. They had, I think, about 30 people sign up in the first month of Romney Care back in Massachusetts. So certainly they have started with the same slow, glitch-prone website and a lot of hiccups along the way that we're experiencing right now in this country. Yet, over 7 years, they were able to bring several 100,000 people into insurance that weren't insured before. So when we go to conferences, when we meet people from Massachusetts, we don't sort of sit down and worship them and everything like that because, they're pretty normal policy wonks just like us. But they have been down this path before us. They are the people who can tell us, what works and what doesn't work. And they're actually tackling the problems that we're going to be tackling 5, 6, 10 years from now as well. So it's interesting that Massachusetts is an example within your research and academic studies that you do to take a look at, because they're like the Apple of states. They're thinking well outside the box and well ahead of just about everybody else. And one reason why is that they were the pioneers. They did this first. Jump to the next one. In Utah, unfortunately, our uninsured rate isn't 3 to 4%. It's 13.2%. According to the latest Department of Health surveys. In Salt Lake County, it's 20%. In urban areas like Ogden, it's much higher than the state average. And you can look and you can see that it's definitely ebbed and flowed. And what we've had in our country